Everyone. I'm really delighted to welcome my good colleague, Dr. Helen Aveyard, today, who's going to talk to us all about doing literature reviews. So Helen doesn't come specifically from an education background, but we're going to explore a little bit in this session together about what higher education literature reviews might look like and how that may or may not be similar or different from some other disciplines. So Helen.
Thank you very much, everybody, for coming, giving up your lunchtime. When I was preparing these slides, looking now at the title, I realised that title is actually quite ambitious. What are the different methods for doing a lit review for research in higher education? And when I just looked at it just now, I thought, oh gosh, okay, so we've got quite a challenge for the next hour. But exactly as Louise says, my work really for the last 20 years has been exploring and examining methods for doing a lit review within health and social care, often for undergrad students, also for MSc students. In fact, third edition of our postgraduate guide to doing a lit review, I just received my hard copies of that this morning. So I've looked at it from undergrads, also for postgrads, and then of course also for doing my own reviews, within that as well. So over the last 20 years, I've got a really, really clear idea of how the picture lies in health and social care. It's often challenged because not everyone agrees with that, and that's great. It's always really interesting to see what the differences are. But also in the last 20 years, I've also done work with other institutions, for example, Epigeum. I don't know if anyone's ever heard of Epigeum. It's a sort of learning organisation. It used to be attached to Imperial College London. I'm not sure it is anymore, but they produce learning materials, and they're all interdisciplinary. And about 10 years ago, they invited me to do one on literature reviews, but it wasn't for healthcare. It was across the board generally. So history, English, every single discipline it had to be relevant for. And whereas when I thought, my goodness, that is an impossible task, when I started doing it, we found way more common ground than maybe we originally thought. So that was a very interesting exercise. And it really as well made me think in a different way about the things that we do in health and social care as well. So I guess that one of the purposes of this seminar is to look at how we might be doing a lit review within higher education. But as a sort of backdrop to that, I'm going to explore a little bit how literature reviews have emerged in health and social care. And we can see parallels, we can see where maybe other disciplines deviate, why, etc., etc. And please do give examples of your own field, and we'll see what I'd like to see in the end if we have got some sort of structure for what literature reviews might look like within higher education. So that's what I thought we would do this morning. So in this session, we will look at reviews of empirical research, because healthcare, what probably is a massive feature of healthcare, and you can tell me if it's the same in your disciplines as well, is that empirical research is absolutely, it dominates, and for reasons which I'll go on to in a minute. So a lot of the reviews in healthcare and social care are reviews of empirical research, but not all, because we still do reviews of scholarly work, reviews of theory, and we also do reviews of methods. So my hunch, and I think this probably applies to health and social care, is that the different types of reviews that we do fit into one of those three categories, and reviews of empirical research dominates. So we might just come back to that at the end and see if we feel that there's a similar structure within education, and maybe a different type of review dominates. There might be a different type of review that I haven't sort of put in there. But so hold on to those thoughts, and we'll come back at the end and we'll see where we feel the situation is in education. Why does empirical research dominate in healthcare? And for me, people might have different views, but for me, the answer is really, really clearly sits with the development of the Cochrane collaboration, which probably most of you have heard of. It's a collaboration. It was established in Oxford in the early 1990s when somebody called Archie Cochrane, who was the founder, really came to realise that, and this might be surprising to some of you, that although we had lots and lots and lots of treatments, for lots and lots of treatments, there was zero evidence base for them. Why are we doing tonsillectomies on children? Well, there just wasn't evidence. It just seemed the logical thing to do. And that applied to loads and loads and loads of treatments. And he basically said, this is not good enough. We really do need to have evidence informing our care. And with that, what we call the systematic review, or one of the first really sort of comprehensive approach to literature reviewing, emerged, because what he encouraged was to take individual pieces of research, bring them together, and see what the overarching picture was from that research. The slide here represents a forest plot, which is the way you show if an intervention is effective. And I use this slide quite often, especially with sort of undergraduate students, because it might look a bit, oh my goodness, what does that show? But actually, it's quite simple. And the diamond on the left of the long straight line down the middle shows you, if it's on the left of the line, it shows you that the combined results of all the studies are represented in the horizontal lines, in the 7 horizontal lines. The diamond if it's truly on the left of the line, shows you that the studies are effective. So basically, in the early with this slide, because it's a bit mathematical, etc., but at a first glance, it's easy to interpret. If the diamond sits clear of that vertical line down the middle, which they call the line of no effect, then that gives you evidence that all of the individual studies that have looked at do we do a tonsillectomy on all children, that whether or not that treatment is effective. And this was absolutely revolutionary in its day 30 years ago, because until that, and it might sound hard to believe, we just didn't have this type of evidence. So it's probably, a lot of people say, and I don't disagree with them, a lot of people say that these type of reviews, so they're often called Cochrane systematic reviews, literally transformed healthcare. And we were able to identify what procedures and what interventions worked and what didn't. And it's probably also fair to say that all of our, we live in an age where we're very lucky these days that all of our treatments, you go, somebody who needs cancer treatment, the treatments are now based on stacks and stacks and stacks of these randomized control trials, which have been summarized in systematic reviews. So that's a massive influence in healthcare, and Cochrane collaboration systematic reviews often viewed as the gold standard. But essentially what they do is they have a research question, they search for all the relevant information, relevant research on that research question, and they analyse it in order to show what a summary is of that research, rather than relying on individual pieces of research. So you can see there the principles of a lit review there coming out really, really strongly, in that a literature review is looking at the all of the evidence as a whole, rather than just individual pieces of research. So that's what, and that is a massive influence in healthcare. And as I've put there, Cochrane's challenge to the medical community to find evidence to justify the treatments that existed. This is the method for doing a systematic review. Meta-analysis is the statistical calculation at the end with which you arrive at that diamond on the chart. You need a focus question about the effectiveness of a treatment or intervention. You need a planned and a thorough search strategy. including grey literature, but the focus for these original studies is always research, and it's always randomized controlled trials, which are the trials where you compare one thing against, and you divide a group in half, one, just like they did with the COVID vaccination, one half get the treatment, the other don't, and you watch and wait and you see how individuals fare in each group in order to tell the effectiveness of the treatment or the intervention. You do critical appraisal. Generally speaking, only research papers with a low risk of bias will be included. And you do that statistical meta-analysis where it's possible, but it isn't always possible for reasons that I don't think we need to think too much about in this. But this is probably where lit reviews come from in health and social care. Why these early Cochrane collaboration systematic reviews really were a very dominant force and an incredibly positive force in the development of research within health and social care.
Mary, can I pause you there, Mary?
Absolutely.
Sorry, Helen.
Yep.
Just had a question in the chat about RCT. Can you just clarify that abbreviation and what it is?
Yeah, absolutely.
Thank you.
Randomized controlled trial, which is your classic experiment if we want to find out, does something work or not? So does tonsillectomy, does that help children who are getting frequent tonsillitis? What you do, you set up a trial, you randomize children to either go in the tonsillectomy group or the do nothing group. If you're a parent, you might think, well, I don't want my child to go in the do nothing group when tonsillectomy is a standard treatment, but that's and that's sort of a different question, I suppose, if you like. So you divide them at random. One group has an intervention, the other doesn't, and you follow them up, and then you look at the difference between the outcomes in each of the groups. And the vast majority of world scientists would say this is really the only way we can know if something is effective or not. And as I mentioned, it's the way we knew about the COVID vaccination. We gave some participants the new vaccination, some had a different vaccination. Everyone was blinded. We followed them up and we looked to see how many cases of COVID were in each group. And when everything was unmasked, you'll remember the day when the results were out, and it was evident that there was way fewer COVID incidences in those who were in the vaccination group. So it's your sort of gold standard way of finding out, does a treatment or an intervention work? So since these Cochrane systematic reviews, which are all about finding out, does something work or not? Breast cancer treatment, is a clear example. Back in the 70s, we didn't know if you needed a mastectomy or a lumpectomy, things that are now absolutely everyday information. Women were asked, are you willing to be randomized into different groups? So again, very difficult decisions for the women involved, but it's how we progress with knowledge. And if they agreed, they were randomized. Some were given a lumpectomy in one group, some were given a mastectomy in the other, and they followed them up to see what difference that made in terms of clinical outcomes. So really, really, really important studies. But there are other types of literature reviews, and what happened, so when Cochrane was established and became such doing such sort of life change, sort of information, evidence changing reviews, there then became a whole lot of interest in doing different types of literature reviews on questions that weren't just about does something work or doesn't it. And what I found in that era, there was a proliferation or expansion of approaches to doing lots of different other types of reviews, not just systematic reviews about does something work or not, and not just reviews which have that statistical analysis at the end, that meta-analysis, the chart that we saw at the beginning. So systematic reviews using qualitative evidence, using mixed methods, possibly using mixed methods, possibly using quantitative research, but maybe not analysing it statistically. So there then became lots and lots of other approaches. They all prioritised the use of research if it was an empirical question. So what are patients' experiences of attending ED? You would look for research that had actually explored patient experience, and you are prioritising research rather than anecdotal opinion. Most methods recommend, and this is where I know it's different in other disciplines, and it's something that I'm always interested to find out more about. Most recommend reviewing the whole body of evidence, not a sample. So, for example, if you want to know what it's like to wait in ED, what's the waiting like in ED, rather than just finding a sample of 10 and writing just using those, most methods say try and get all of the body of evidence. But if it's a student project, you might then put limitations on it. You might say, well, if there's loads of papers, you might say, well, okay, in the last 5 years or the last 10 years or whatever that is. But the idea is that you get the whole body, not just a sample, because a sample might be biased. So the proliferation of lots and lots of different types of ways of doing a lit review. And I actually did an audit with a colleague, and we looked through some of the health journals in order to see how what type of literature reviews are now being undertaken. And we found so many different approaches that the field's actually got quite confusing, and you know, students might not even recognise a literature review because it might be called something else. Evidence synthesis is a really common name, but we found about 35 names of doing a literature review. So proliferation is a good thing because more and more people are realising the importance of doing a lit review, but lots and lots of different approaches. All for an empirical review where you're sort of aiming to get research, they all have these common features. Setting a question needs to be very focused for the reasons that I've mentioned before, that you don't want you want to get a very focused amount of literature rather than a broader question getting lots and lots of literature, but just tapping, scraping the surface for that. They all then recommend searching for literature.
So I did this.
They all then recommend searching for literature using an appropriate search that's relevant for your particular discipline, with the Boolean operators and the relevant academic databases. They all recommend appraising the literature, so identifying strong evidence from bad evidence, and then some sort of analysis, writing up, which is then written up. And those stages, I would say, are common to all of the literature, all of the reviews which are done from this empirical basis. That is, where you've got a question where you need research evidence to answer it. And here's just to show you just a small selection of the type of reviews that are very common in healthcare, but these won't just be healthcare. I'm sure lots of you will probably recognise these reviews, these types of reviews in other disciplines as well, but a meta-aggregation, a meta-ethnography, a thematic synthesis, meta-synthesis, integrated review, meta-analysis, realist review. But there are lots and lots of types. But there are lots of types, but they do actually generally follow a fairly similar pattern. And I would also go so far to stick my neck out and say that for BSc and MSc, the method is really quite similar. It's when you get sort of to higher level study that the differences really come out. At PhD level, we encourage our students to follow a method because it sort of helps keep them on track. But those basic principles of a lit review are pretty similar throughout. Common problems encountered. Setting a question that's far too big. We're always saying to people, I think that's going to be way too big, reduce it somehow or other geographically, or with, just saying UK only, or with dates, focus it on a particular date rather than going maybe back too far. Searching for literature, quite often it's not comprehensive, and we're really trying to stop students from cherry picking the information, because the old style literature reviews were pretty much, and in fact, dare I say it, the one I did for my own PhD, if I looked at it now, it wouldn't pass. You just, in those days, cherry picked what you thought was relevant, put it in there. And if I was marking that thesis, that would be a first thing I'd comment on probably, but it just shows how times and expectations have changed. Appraising the literature, quite often again not undertaken, and analysing the literature, there's quite often not a clear method for doing that. So that's just a summary of the problems which you might recognise as well from your own particular disciplines. I've just included this because in healthcare, with very particular search strategies, with very particular use of the ands and the ors, and I don't know, I'm interested if this is the same in different disciplines. So we recommend for searching, you find a keyword, you find all the synonyms, which are words that mean the same, but they've got to mean exactly the same, which is another pitfall that people do. And then you combine those with and then you only get the papers where all of the keywords appear, because and ensures that you only get papers where all of the keywords are in there. So another pitfall is that students quite often put too many ands, and then they find that their search is so specific and they'll have no hits or maybe one hit. So again, it's a real skill to search so that you are finding that appropriate body of literature. It's not intuitive either. Sometimes people think, oh, well, if the keyword is in my title, I've got to search for it. And it's actually quite often not the case. So you do need to understand the logic behind the searching. In healthcare, we use a lot of tools to assist in literature reviewing, and I'd be interested to know if they are popular in other disciplines. I'm not a fan of all of them. So, for example, acronyms such as the PICO tool is really common, but what they can do, so the PICO sort of means, okay, population, intervention, comparison outcomes, that's what you've got to have in your research question. Obviously, that one only applies to quantitative research, but tools can mean that you get a rubbish question and you sort of shoehorn, make it try and fit an acronym. So while I think they can be useful, they won't get you a good question unless you've got the makings of a good question already. Critical appraisal tools are very common in health and social care. So they're like checklists that sort of say, help you to understand a paper. Have they done this? Have they done that? You should be, if it's a qualitative paper, be looking for this, this and this. And again, I'm aware that is very discipline specific. And in disciplines where they don't use appraisal tools, they appraise the paper, but it's way more intuitive. Whereas we in health and social care, we've got a much more explicit way of doing that. So again, interested to know the trends and practices in other disciplines. But I think it's like anything, the more experienced you become, the less you rely on tools. I think that's probably fairly, most people would agree with that. Analysis tends to be either numerical, which is that meta-analysis, that forest plot that we saw in the first slide, or a narrative analysis. And I've just got a quote there from to sort of summarize what a narrative analysis. It isn't that there are various stages of narrative analysis. At its very basic stage, it's just sort of summarizing, but and all the evidence, bringing it together. But at a way more sophisticated stage, it can be way more than that. Sandalowski says, integrations that are more than the sum of the parts. These interpretations will not be found in any one research report, but rather are inferences derived from taking all of the reports in the sample as a whole. So, but generally speaking, you'll find either a numerical analysis or a narrative analysis, and a narrative analysis can include can be used for qualitative papers only, mixed methods, or qualitative and quantitative where you don't do a numerical analysis. So that's a kind of quick summary of how we in healthcare, how we do reviews of empirical research. So we're fairly sure that there is research evidence to answer our question, and where research evidence would be prioritized. But we do other forms of review as well. So reviews of Scotland, because obviously not everything we want to find out has been researched using empirical research. So there might be that we would also do reviews of more scholarly work, which I'm thinking is going to be very relevant to a lot of people here. Possibly a review of theories that might then relate to further work going on. I'm interested as to whether the approach there to systematic and comprehensive searching for the papers, the literature that would be included in these in different forms of reviews of scholarly work, which we can discuss in a minute, and also reviews of methods. So we always, I for one, always encourage students at doctoral level of all disciplines to review, to do some sort of review of the methods that they're using. So maybe see how other people have used approaches and so on. So that concludes my presentation. That slide concludes my summary of of the type of reviews that are done in health and social care. And I would just like to open it up now to people from other disciplines. Where's the emphasis of your reviews? Do they fit into that, or are there other categories that aren't on that screen? And just open up for discussion. Thank you for listening.
Thank you, Helen. Thank you so much. I think you probably raised lots more questions than you've answered, maybe, for people, which is great.
About that.
No, that's great. So yeah, I think it'd be really interesting to hear if anyone has had experience themselves of doing any form of systematic review in higher education, and would like to share their experience first of all. Anyone like to volunteer? Or even it might be that you just put in the chat that you haven't done this, and that in itself would be really interesting to get a sense of how.
Yeah, and while people are thinking, I also have to be really careful because, so for example, I've examined PhDs in different disciplines. So, for example, maybe in education, and I go to the lit review, and it's like, oh, well, I wouldn't have done it like that. But there isn't a right. There often isn't a right or wrong, and so you have to think, okay, what is consistent with this discipline, which I think is another really important point to bear in mind. Some people tell me that I'm too focused on the lit review. But again, it's where individuals have their sort of focus.
I've just seen a couple of people putting in the chat. So Paul, you said you were part of a group that took a systematic review once, and you employed the help of a health faculty librarian. Okay, what was the topic of your review? Do you want to share that?
Yeah, it was a slight throwaway comment, but I think for me the point was I find systematic reviews are very comprehensive. So from my experience, I'm more used to sort of general sort of educational literature reviews. I feel like they're the top ends, and if you do them on an ad hoc basis, like I've experienced in the past, it's probably better to get an expert in. That was my perspective. Unless you feel it's a skill you want to develop yourself that you're going to engage in regularly.
Yeah, I mean, that echoes my experience a bit, particularly in terms of supporting students who, most of my students do a literature review based dissertation, and the librarians are fantastic sources of support because they're working with databases and finding articles all the time. So, yeah, if you're kind of serious about doing a systematic review for publication, then definitely getting support from library staff is a really good suggestion. Sian, you've said you're partway through your first systematic review. You have a question.
Oh, yes. Thank you, Helen. That was really interesting. You were talking about where you find material. And I'm partway through my first systematic review, as Louise has just said. And I'm looking at forward searching, backward searching on articles, which I'm potentially going to include. And my question is actually, where do you draw the line on the forward and backward searching? Because it would seem to me that I could be doing this ad infinitum.
I think my own view, and if I was examining a thesis, I would expect a clear search strategy. I would expect some evidence of additional approaches like forward backward searching, hand searching, reference list searching. But I would also, you're not going to fail a Viva because you've missed one paper. You just won't. So and you've got other work to do, haven't you? So for me, I would certainly expect that, but I wouldn't expect if there was one paper that that doesn't find that the examiners seem to know about. That for me is you just slot it in. You say thank you very much and slot it in when you do your corrections. So yeah, I'd move on. I think would be the advice.
Can I ask a question related to that? You said forwards and backwards searching. Do you want to explain what that means? Maybe Sian, do you want to explain what that actually is in practice?
Yes, so this is looking at the reference list of the included paper and following up on the references that paper's mentioned. But then also looking at which papers have referenced the paper that I'm looking at.
Okay.
So making a little spider web, really.
But when I started looking at lit reviews, we really emphasised doing additional searches other than just the databases. But I think as databases get more specific, people are finding less and less, and there's maybe less emphasis on it. Can I ask about the concept of databases? Does everybody feel that they've got good databases which are subject specific to their own subject? Or is anyone using Google Scholar?
That's a good question. I mean, most university libraries would have core databases. I mean, I guess I use PsycInfo a lot. I should probably know if there are education focused ones.
I can jump in with something here, just that I
Thanks,
work in
Kathy.
sustainability education, and so it crosses multiple disciplines. So this creates lots of difficulty in evaluating strengths and weaknesses of things, but also sustainability education. Sustainability does sit in various databases, but it might be to do with the environment or recycling or procurement. But it also might equally be to do with emotions and psychology and social change, for example. So it can be really, really difficult to look for information. And lastly, that sometimes there's really important information that doesn't sit inside academic journals. So it might be program delivery by certain educators or NGOs or whatever. So it's quite a tricky. It was really helpful to hear the overview, Helen, and see how it's done in HSS, and think about how different it is in different disciplines that I'm dipping into.
Thanks, Kathy. Going to move on to the next question from Odinaka, who's asked, what's the difference between a standalone literature review and one integrated in the body of a thesis? So I'm wondering, are you a PhD or EdD student, Odinaka? Helen, maybe. Oh, yeah.
Yeah, that's a really good question. So my view on that is that if you're doing a PhD or an MSc or a doctorate or whatever, you will do a lit review, and it will be prior to your main study. So the purpose of that lit review is to identify the gap. We might know lots and lots of stuff about X, but we don't know why, and why is your research question, if you see what I mean. So that's where a lit review is prior to your research, your actual research question. And in days gone by, as I've said before, they could have been a bit hit and miss. And that's what was in my own PhD. Just collected a few studies, said this has found this has found that, but it wasn't comprehensive. Nowadays, people would generally expect them to be comprehensive. But a standalone study is where the lit review answers the question that you've set out. So Cochrane collaboration reviews are standalone. They'll say, what's the evidence for doing tonsillectomies on children with tonsillitis? They answer the question. It doesn't go on to doing another piece of research, although they might conclude that they do need more research. But the aim is to summarize what we know rather than identify a gap in order to then develop a research question. Does that answer the question?
I think it does, Helen. Thank you. Hefzibah, have you got a question?
Yeah, I was going to sort of say to the previous question regarding database. I mean, I actually sincerely start with the database from the library website and go through it. And then sometimes it's very frustrating. You really don't get the actual ones or the or enough to go through. And I do fall into the temptation of looking into Google Scholar. I mean, I can see there is a question, would you recommend Google Scholar as a reliable one? There's a question from Paul. So what is your opinion about looking into, because I'm sure most of the academics do look at Google Scholar.
I mean, for me, Google Scholar would be just a supplementary one. It wouldn't be but I don't know, the librarians, you know, they've got the, you know, first the top information on this, because databases keep changing. For me, it would be a supplementary one rather than one I'd use. But if you use it alongside, because generally what people do is they'll so for nursing, you know, CINAHL is very, very important, but you've also got the sort of medical ones like Medline, or like Louise said, PsycInfo. So what I would do is run the searches on those, but then run it on Google Scholar as well. And you've got, I would always advocate, in order to keep the review focused, you've got inclusion and exclusion criteria. So the inclusion criteria might say, well, I want, research on this particular topic and between these dates and etc. And then when you go to Google Scholar, you just see which of those, A, there might be duplicates from what you found already, but B, if you find research that you haven't found already that meets your inclusion criteria, then great, then you would include that. So a cautious yes, but again, I would absolutely consult our librarian colleagues as well, because they're the ones who are really ahead of the game on the databases in your particular discipline.
And also, I've just put a link in the chat there to remind people about our previous session by Isabel Virgo, who talked about using AI for research. And one of the things she touched on was some of the Gen AI tools that can help you find literature now as well, again, as a supplement to those databases.
Yeah, it's definitely, thank you, Louis. Yeah, it's definitely a supplement. But you might put into ChatGPT what are synonyms for this particular word, and it might throw some up, bearing in mind it also throws up a load of rubbish very often as well, doesn't it? So it can be a useful tool, but you would never use it, obviously, to say search for articles on this, because half of them would be fictitious. But anyway, I'm sure people are very much aware of that.
Okay. All right, so we've got a couple more questions. Sakshi asks, how relevant are narrative reviews in research areas where empirical evidence is limited? So it's about narrative reviews. How relevant are they?
Yeah. So narrative reviews, it can be defined in two ways. They either mean, and this is going to be confusing, they either mean anything that isn't a Cochrane systematic review in healthcare. Or they can mean a review that basically is like an essay and hasn't been done in a scholarly way. So in healthcare, they tend to have two different meanings. It can be a pejorative meaning. A narrative review is just one without any method at all. Or it can mean just an alternative to a highly controlled systematic review. The main thing is in my discipline, the main thing is the method that they used, is that transparent and convincible as a method? So a narrative review might be a useful review, but the way to find out is if they've what's the method. And I think in terms of if there isn't research, I think certainly in healthcare, research, it's hard to find an example of where research isn't the best evidence. But once you've got research, you might then look for, you might include, for example, anecdotal evidence, but you'd have a clear rationale as to why you were doing that. I suppose I've given a bit of a convoluted answer there. Does that help at all?
I think it does. I think, again, you're saying that the term can depend on the discipline, but ultimately, if it's a good review, is going to have a transparent method, it's going to be comprehensive, and those are the key things. It's clear how you found the literature you found.
Yeah, I think so.
Yeah. Another question from Shyla. Could you explain about useful softwares for systematic reviews like Rayan?
Yeah, absolutely. So when you've got your papers, you then have to make sense of them, and there are these software out there that will help you do that. Now, but all they don't do the analysis for you. Unlike if you're doing statistical analysis, if you're doing a meta-analysis, there's software that will absolutely do that for you. I think even ChatGPT will do it for you, but how accurately, I don't know. But if you're trying to analyse literature in a narrative way, there is software such as Rayan, such as Covidence. And what they do is they help you organize it. So they help you identify codes in the literature that then develop into themes and so on. So they are useful. At PhD level, I tend to say to students, if you want to get your head around something like that, then that's great, but not essential. But bigger teams, some of you have probably been involved in sort of cross-university teams where I'm involved in one at the minute where we're using another one called Covidence, and it's really useful because you can share everybody can share the same folders and the same resources, and you can see. So, but all they do is organize it. They don't do any of the analysis, unlike the statistical tests that can be done.
Brilliant. Thank you, Helen. I've just put a link in the chat there to a paper by Joseph Crawford, who's the editor-in-chief for the Journal of University Teaching and Learning Practice, and he's written an open access editorial about why I rejected your systematic literature review in higher education. So if you are thinking about trying to produce one that's, and publishing it in the higher education field, this will be a really useful resource that to kind of highlight some of the pitfalls and how to avoid them in higher education. Okay, we're almost out of time. We've got time if anyone else wants to ask one question. Otherwise, that was really good, Helen. Thank you so much. You've generated lots of discussion, and I think that was one of the best attended sessions we've had so far. So,
oh well, you're very welcome, and thank you. It's always interesting to discuss how disciplines differ and converge. So thank you for
and I think a lot of us in higher education we're multidisciplinary and then wanting to also support student learning. So we've all got different disciplinary backgrounds as well, and how do you bring that in and use a robust method relevant for higher education? So, thank you.